So we're here today to discuss the Charlie Mayfield report and how we think health coaching can support employers and employees. So should we just have a quick recap about what the report says? So the purpose of it was to look at why people are out of work due to ill health. 1 in 5 people out of the labour workforce because of ill health, which is costing the economy billions. So the first phase, which this review relates to, is the discovery phase. So Britain's actually behind other countries in terms of its economic inactivity due to ill health. So what we've learned from other countries is that some of the key areas to address are prevention, early intervention, better support in terms of case management and dealing with absence to get people back into work once they are off sick, and more proactive involvement from employers. So in terms of the legal sector, which me and you, Anne-Marie, have both worked in for over 20 years, with the Law Care Life and the Law reports recently come out, which shows there's very poor wellbeing. About 60% of people record poor wellbeing in the legal sector. So high pressure work environment, high job demands, low wellbeing. There's a perfect storm for poor ill health. So really, it's in everyone's interest, isn't it, to address this issue. And the third phase of the Charlie Mayfield review will involve government recommendations, and it's looking at more proactive involvement of employers. So it's coming. We all need to start thinking about, how employers can more proactively support employees. So if we want to look at the business case, because obviously in terms of reducing presenteeism, absenteeism, there's lots of benefits for employers. It's not just about supporting the economy and society. There is actual hardcore benefits for employers. So Anne-Marie, do you want to expand?
Yeah, absolutely. I mean, we're health coaches here, and there's such a strong business case for bringing health coaches into the workplace to really kind of plug this gap that the Charlie Mayfield report has really highlighted. So I think one of the first things that would go into a business case, which would be a key driver for having health coaches support this, is improved retention rates. The Keep Britain Working Report has made one thing really, really clear, that once someone leaves work due to ill health, the likelihood of them actually coming back is pretty low. And health coaches can really support people whilst they're still at work, helping them stabilise their health, keep them energised, which obviously directly impacts retention. I think the second thing is around fewer sick days. The report has really highlighted, hasn't it, the scale of the problem. I think it's 150 million working days are lost every year due to sickness. And this is costing employers around £120 a day in lost profit, which obviously that's just going to really add up. So by giving employees early personalised support, health coaches can really kind of help reduce the likelihood of issues maybe escalating and becoming these kind of long-term absence issues. I think the third thing that should be in the business case is around better morale and loyalty and recruitment appeal. The final report, which came out just a few weeks ago, really stresses that employees increasingly expect the workplace to support their health, not just as a perk, but really as a kind of basic standard. And I think offering access to health coaches really signals to your employees, we genuinely care about human health at this place of work. So that definitely improves morale. I think it strengthens loyalty, and it kind of helps you stand out in a competitive market, which I think is something that, we're going to talk about in a little bit. And then I think the fourth thing is around avoiding the cost of losing that intellectual and relationship capital. Replacing an employee once they've left, I think the average is around £11,000 by the time you've taken into account recruitment costs, onboarding, loss of productivity, and in some industries, it can be 10 times that. So it's a huge cost on a business. But I think health coaches, they could really help prevent, some of these avoidable exits, especially if those exits have maybe been triggered by maybe unmanaged stress or a chronic condition or burnout. So that really protects the business from some of those kind of hidden costs. And then I think finally, businesses have just got to really start seeing health as a business asset. The report repeatedly positions employee health as a driver of productivity, not as an HR kind of add-on. And really, health coaches can help organisations move it upstream, preventing the decline rather than reacting once it's just way too late. And that really does align kind of perfectly with the report's recommendations to really help keep people healthy in work and participating. And then I guess if we kind of zoom out from it, you know, the whole bigger thing in the sort of wider economic sense is the Keep Britain Working report estimates that improving health and retention, it could generate something like between £3 and £8 billion in annual benefits to employees over the next few years, which could really quickly escalate to, I think, 18 billion by the year 2030, which is, you know, phenomenal. So bringing health coaches, I think, and I think we all agree, don't we, is one of the clearest and most direct ways that employers can really capture those benefits, because it acts where the report says intervention is most needed, early, and once the employers are still kind of in the workplace. So any thoughts on that?
I would just say this, you know, obviously this is a recent report, but it aligns perfectly really with the NHS 10-year plan, you know, healthcare setting, which is responsible for health downstream, especially, you know, when it's deteriorating. Implementing this sort of in alignment is across the board, isn't it? It's kind of moving health out of just healthcare itself and making it a national priority. So as you said, Kate, about the different phases, this is coming one way or the other, because it has to, because the economic cost is just not sustainable anymore. So I think, as you've said, Anna-Marie, health coaching is a really well-placed intervention to really help support workplaces in moving things in the prevention and kind of health optimization direction.
Yeah,
okay,
absolutely.
There seems to be so much emphasis on collaboration between employers, between government, between organisations, stakeholders, communities. Everybody needs to work together to improve the nation's health for everyone's benefit. And that's what sort of comes out of the NHS plan, with moving things into the community and obviously prevention. It's what's coming out of this report. It's the future, and health coaching just seems a really good catalyst to make some of this stuff happen on an individual, you know, to actually implement it, to start implementing some of these initiatives.
Basically, the intervention, wherever health coaching, wherever there's people, is the opportunity for early intervention, like the report mentions, to capture these opportunities where health may be deteriorating, or it may already, you know, it may be compromised, or even just an opportunity to improve it even more, which is a long-term investment in that individual person. You know, health coaching is well placed across all sectors to help with these priorities.
Yeah, 100%. It's really interesting talking about, you know, community and obviously individuals within that community. So how do we think this is going to impact, you know, different people, different sort of categories of people, you know, within the workplace?
Well, do you know what I find interesting? In the report, it says how when managers are dealing with absence, they're uncomfortable. Managers aren't necessarily trained to deal with absence, to have the conversations about illness. And the similar things come out of the Law, Care, Life and the Law report. Managers they don't necessarily receive training, the need to be able to, and then the time, you know, they're not given the dedicated time with targets and things to do proper people management. And health coaching, in my mind, kind of, it normalizes conversations about health. It reduces the stigma. Let's all just have conversations about health. Everyone's got health or not, you know, on some sort of spectrum. And you bring it with you. You know, you can't park it. It comes to work with you. And let's normalise the conversations. Let's embed these discussions and health coaching approaches throughout organisations. So leaders, team leaders, managers, everyone's comfortable to have these conversations, or at least to signpost people in a compassionate way to someone who is comfortable to have those conversations.
And in line with what you just said about, you know, embedding it throughout organisations, let's also remember that health, an individual person's health doesn't exist in its own silo either. It just like aspects of a person's health doesn't. One person's health could be impacting on people around them as well, whether it's because they they're not functioning at their best, or because their mood's compromised, or all different things. So you've kind of got the impact this way through the different layers of management. You've got the impact amongst peers and colleagues this way. And health coaching is by nature, it is a very kind of holistic approach that looks at, it's looking at people in the context of their environments, like the wider determinants of health, such as their workplace, and it's looking at all aspects of that person's health. So my point being, remove the silos, whether it's applied to sectors, whether it's applied to individuals and teams and HR and whoever's doing occupational health. Health conversations need to be across the board, and whole person centered, not just looking at bits of people, looking at people. Is my thoughts.
100%. It's complicated. I imagine businesses are probably reading this report and they're probably having some will be on board, some will be ready for it, some won't, some will know where to start, others won't. And I guess it's going to present challenges, particularly for maybe smaller business, but for any business, there's going to be challenges in terms of how they're going to implement some kind of form of wellbeing program. So what do we think some of those challenges are going to be, and do we have any of the solutions maybe for what that could be?
I think some of the challenges businesses face are the budgets for wellbeing are small and they're siloed, whereas to me wellbeing comes under many aspect. It should come and sit under many budgets. So innovation, have a list somewhere.
Sustainability,
ESG, development, all of them. But also, I think there needs to be a shift in mindset, because to get buy-in, understandably, leaders want to know about return on investment. But wellbeing doesn't necessarily lend itself very easily to that kind of cost-benefit analysis, because results can be longer term. You might have to wait before you see the impact of a wellbeing initiative on turnover. It's going to take some time to get those figures, and you need the data. Like, are you actually collecting good quality data on sickness and retention and nutrition and presenteeism and wellbeing? So you need to be measuring the right things, and you need to know what you want to be measuring, because if you want numbers, which return investment, often people want to think in numbers, you're not going to capture the full impact of a wellbeing initiative, because a lot of the impact is going to be on your culture. You can really measure that with qualitative data. You want to be getting feedback from employees, understanding their lived experience and perceptions. You could get feedback in appraisals, in performance management reviews, that sort of thing. Yeah, I feel like there has to be a shift in mindset about, to get the buy-in. Are you wanting to see numbers? Do you have to know, for every £1 spent on wellbeing, you're going to get £10, save £10 from loss? Or do you want to see this change in your culture where employees, want to be here and they feel like their wellbeing is supported and they feel like they're thriving at work, So I feel like there has to be a shift upstream in mindset. And that's one of the barriers, the difficulty implementing it. It's got to be embedded in culture for it to be most effective, I think, rather than just an add-on. It's like you can have apps and they can form part of wellbeing initiatives if people use them, but do you know if people are using them and what benefit they're getting from them? Are you measuring that? Or are you just, are we paying out for these things that, maybe the money be better spent? But yeah, I think the key, the barriers are the return on investment and the budgets. You've got to, I think it needs to be going back to the drawing board maybe about, what does our return on investment, do we want to look at return on investment, or do we want to look at impact? Because to me, impact is broader, and that's more, it's not even just about the individual, it's about the culture.
Also, the concept of health capital, because, the cost of, the gains of people being well and the cost of them being ill, there's not many ethical experiments you can do here when it comes to wellbeing to get a return on investment kind of quantitative data, because you can't, no one's going to deliberately withhold something that could be valuable to see how much, to see what the costs and benefits are. a lot of them are going to be very intangible, aren't they? They are, like you said, Kate, they're going to be very difficult to quantify.
And marginal gains, like cumulative over time, but it can be difficult to pinpoint exactly when and where and how, you know, an improvement has taken place.
Like really, the kind of return on investment is going to show indirectly down the line as a, you know, depending on what that person's health becomes. But you know, you can't quantify any of this. I can't. Don't know if you can, Kate.
No, in terms of the shift in mindset, I sometimes wonder, like, should we even be looking at well-being in terms of return investment in that direct way, or in the same way, you know, to operate as a business, you would need premises. You wouldn't necessarily look at the return investment of each square foot, you know, to calculate. You wouldn't look at it in that way. It's self-evident. You need premises to function. It's like, well, is it actually self-evident that you need people well and healthy to function optimally? You know, especially in industries where it's all about the cognitive performance.
Yeah.
I think yeah.
I think that's exactly right. It's very hard to say, but for this wellbeing initiative, we've had that output on our bottom line or whatever it is. But I'm sure, you know, board of directors will be walking around, you know, they'll feel it, you know, there'll be that intangible. This is a really happy place, you know, people are bouncing around, and of course that's going to impact productivity, and of course that is going to obviously impact revenue, bottom line, profit, etc. But it's just not going to be linear in a way that I think maybe a lot of board of directors would really like it to be or expect it to be. So, you know, what you said right at the very beginning there, Kate, you know, that mindset shift in terms of this can only be a good thing. The return on investment, you know, it's not going to be 10x in 1 year, or, you know, we can't put that on it. But what we can put on it is it's going to be better and not worse. And I think it links to what you were saying about the challenges as well, that the budgets historically have been quite small. And again, part of the issue is that they're siloed, that actually if they can kind of step back and see this more as a sort of umbrella business strategy, as opposed to a wellbeing initiative that's sort of sitting somewhere underneath HR or in the learning and development team, then those businesses that see that as an overarching business strategy, that they're definitely going to be the winners.
Just one other thing, Kate. You mentioned about sort of the capturing the qualitative data on well-being and things like that. Obviously, health coaching and health coaching encounters are a perfect opportunity to be capturing this kind of information, which are really, really high value insights in terms of what's going on in an organisation, aren't they? You know, like you just said, Anne-Marie. Pardon?
You can identify themes.
Yes. Yeah. And in terms of continuous improvement and kind of, you know, maintaining a healthy sort of thriving culture, if you don't have those insights, you're working blindly, aren't you? So like Anne-Marie said, the ones that are actually engage across the board, you know, applying these kind of human-centered, kind of health-aware approaches throughout all departments are going to be the leaders, ultimately.
Yeah.
I've got one more point, sorry, about barriers, because I think one of the big barriers is getting that buy-in by showing the return on investment. And a big barrier to being able to show the return on investment is, even if you have got quantitative data, or you could get it, you know, if firms are implementing, say, health coaching or the wellbeing strategies, often firms don't want to share the data, you know. Firms aren't required to share this sort of data, and they're not necessarily wanting to share it with competitors. So getting hold of that data to present, to support a case for implementing it, has its own challenges. So yeah, that's another barrier, I think.
But I mean, we don't know, but with the Charlie Mayfield later phases, it may become a requirement to share some kind of data of this nature. So the people that have got sort of measures in place, that will be easier, presumably. And also with the phase 3, was it, where there'll be recommendations?
Yeah.
Presumably people that are proactive, you know, start getting new strategies in place, may well shape those requirements further down the line. So there's opportunity here.
And actually, if there's phase 2, the engagement phase, they want to understand what people are doing and what's working, and get
engagement phase.
Stakeholders to, sort of share information. I don't know if they'll actually share data, but so it might head in that direction anyway, which would be brilliant. You know, obviously if there is data out there, we want to see what that return investment looks like. I think it will always be over time. It's not going to be short term, immediate. And you know what, there's also other things that take into account, because you could have a really effective wellbeing program, but if you've got massive organizational changes going on, that's going to impact people's well-being depending on how it's managed. So there's other variables and things happening. So you can measure, but you're not necessarily measuring, unless you can hold everything constant, you're not just measuring the impact of that well-being initiative in isolation, which is why the quantitative data is difficult.
But let's also remember, as you mentioned about, you know, organisational changes and things, in terms of like resilience and adaptability, people that are physically, mentally, emotionally well, you know, good relational health, good, strong relationships around them, these are the people that are going to be resilient and adapt better to change. So in terms of kind of weathering those kind of storms, that's another good reason to implement health aware strategies and have health coaches in the workplace, because they're a good support, really.
Yeah, well, this is why another reason why I don't think health coaching as a wellbeing initiative doesn't just fall under a wellbeing budget, because you do build those core skills, sort of self-efficacy, resilience, all these other things that could fall under a growth and development budget, because like you say, you can apply that. It's not just for your own health and well-being, it's for how you adapt to workplace changes, or your resilience in like high pressure workloads and across the board.
No, absolutely. And that links back to budget, doesn't it? You know, if you've got a budget because we're going through a reorganization or a merger or something like that, you know, if you have part of that budget for, well, let's just make sure this lands really well with our teams and our staff, and communication and health coaching for those that sort of need it because they don't adapt well to change, because they've had health coaching previously, we know who that cohort of people may be, then that is just setting up the business for success. You know, that isn't even specifically around, you know, people's individual wellness. That's the whole business success of these huge changes that they're going to go through, and it just makes it so much more seamless for the business as well. So yeah, why wouldn't you have that central budget and a much bigger budget, so that you can apply health and well-being coaching support, you know, right across the board in that way.
The coaching approach needs to be woven in to like the culture and the infrastructure, and therefore similarly the budgets throughout, because that's where the impact can be. It's just difficult to measure it.
Coaching by itself is very well recognised as a value in the workplace, isn't it? You know, leadership coaching and all this. So, you know, the coaching as a concept isn't anything new, and it is, you know, popular because its value is well recognised. I think it's just the health coaching bit, it's the health bit that seems to create some kind of barriers. But you know, whether people are worried about the responsibility or it's the nature of the conversations, you know, they feel like they shouldn't kind of step into those boundaries, sort of thing. But what the Charlie Mayfield report review has done is made health relevant, and you know, it's opened up the need to have these conversations, isn't it? So really, integrating health coaching in the workplace is the obvious evolution from what's already implemented in workplaces in terms of coaching, empowering people, building resilience, building all these kind of interpersonal skills that help people to thrive in their workplaces for the benefit of themselves and for the workplace that they're in. It just makes sense.
Totally makes sense. And I think, you know, health coaches, it's not a scary place, or it's not a scary thing for people to implement, because, you know, a health coach isn't there to diagnose or treat. Obviously they're not there to judge at all. You know, they're there to guide and support, to empower the employees, to really, for them to take proactive steps to prevent problems, as much as manage, you know, ongoing issues and challenges that they have, and to maintain overall well-being. And I think a bit that gets forgotten sometimes is that, you know, a health coach can add tremendous value to people that don't have any issues whatsoever, but just enable them to continue being the high performers that they are, so they can kind of continue and have that longevity in their career. So I think that part of it is exciting. I think sometimes, you know, people's automatic thought response is, oh, I've got a health coach, oh, you must have a problem. Yes, I might have a problem, and I'm working on it, but actually it can be for those high performers as well. And I think the big thing as well is to get health coaches in early, because the health coaches are so good at spotting those problems earlier, as we said, before it becomes a scary moment where somebody's struggling so much that they're thinking, gosh, I've actually got to now go and speak to HR or my manager, and suddenly you're straight into OC Health, and insurance premiums are going up because you're using all of these expensive resources. But if you can be empowered to recognize issues earlier on and work with a health coach, we're going to stem that flow of issues going all the way through to massive problems, occupational health, time off work, leaning on our GPs. Obviously, Jenny, you know that oh so well. So it's just such a no-brainer, and I guess I'm just really excited now that this report has come out, and it's giving us a slight platform, I guess, if you like, but it's giving us a really strong reason to go in and talk to workplaces now about, this is coming, the responsibility is on you, and actually we can, maybe we're even saving you money, because we've got a big part of the solution right here. And I'm not sure how many registered health coaches we've got with the UKIHCA, but it's a few thousand. Yeah, how many?
A lot. A
lot. Yeah, a lot.
A lot.
Completely ready to go,
highly
passionate
skilled, registered
people.
health coaches.
Yeah.
I think it's a really important point you've made, Anne-Marie, as well. A health coach in terms of early detection of signs of stress, because sometimes when you're really busy yourself, you're not aware necessarily, and you wouldn't notice signs. Whereas even just by kind of setting intention to see the health coach, at least you're keeping your own health and well-being on your own radar, which can fall by the wayside when you're busy. And you and the health coach together can spot things, and you can learn your own patterns, so you can spot them in future, and just being alert to them, and then so you know when to take that step back, have a little break if you need one, and how to manage the stress, getting all those sort of tools in place before you stress and you're not in the place where you can do it. It's so important to get it all in place beforehand. But even signs of health coaches might help detect other things early, where if someone's saying I've got this symptom or whatever, you can discuss it, and it's a safe space to discuss things where you might think, oh, I'll go to the GP about that when I've got time, when this project's over. But it's just keeping it a bit more on your radar,
front of mind. It's exactly that. And we're probably talking mostly about kind of one-on-one coaching sessions with individuals for their issues, their challenges, their goals that they want to achieve. But businesses can also implement group coaching, and you can actually bring together a certain level of managers, or working parents, or single parents, or parents that have got neurodiverse children. Everybody's needs and stresses are very different, and the stresses of different types of roles can be very different within an organization as well. So I think the group coaching as well can really help raise awareness within a particular team in terms of what causes their particular stress, and actually that can educate the managers giving out the work, or people can actually change how they work because they have a better understanding of how things are landing and what's causing stress. So I think obviously the one-on-one health coaching is unbelievably the best way, and is going to get the best results. But I think the sort of group coaching as well has a huge benefit, and you can put whole cohorts of people together to put them through that kind of group coaching and workshops, and it just raises the awareness and understanding of the whole organization towards health and well-being, and that can only be a great thing.
And it also sort of fosters that the relational kind of capital again as well, because you get that kind of peer support from other people with the same or similar lived experiences, which that continues beyond the consultation sessions, beyond the group consultation. So that's high value. Kate, sorry.
I was just going to say, in terms of group or individual coaching, another valuable aspect is the accountability, because really the whole idea of coaching is to implement the behaviour change, isn't it, to improve lifestyle habits, which then has a knock-on effect. It's like the upstream way to tackle chronic health problems, or manage conditions, or prevent them from happening. So having that accountability of I'm seeing my health coach, we agreed I was going to do this, I should probably get to the gym, or whatever it is you've been working on. Or if it's a group coaching, then when you see your colleagues, you've got that bit of accountability to them. We all know what it's like if you plan to go for a run with someone and it's like, well, I'm going to have to go, aren't I? Whereas I never would have gone on my own. So just having that accountability to other people helps to make that behaviour change stick.
Yeah.
This is where, you know, some of the apps that are a bit kind of an isolated sort of intervention where it's just you tracking XYZ, where these things that are perhaps an add-on could be really integrated in a human way with group consultations and that accountability with peers. So, you know, the app does have some value, but perhaps more so when it's augmented by a human, because people need people, don't they? They need that human interaction.
Especially when, so a lot of us are remote workers nowadays. So if you're kind of even just jumping on a Teams call for a group coaching session, especially newcomers to firms, you might not even had that much contact with people. So it kind of gives you a bit of a network and things. It's just another way for some social connection within your firm and to build some, more bonds and, like you say, strengthen the relational capital.
That's a really great point, isn't it? You know, especially as you said, you know, new people coming in, it takes such a long time, especially if you're, you know, partly working from home or entirely working from home, to build those relationships. And actually, most of those relationships get built over a very, very long time, and it's all work related. But actually, if you're jumping on these group coaching calls, people have been vulnerable, they're being authentic, they're saying, hey, I've got that problem too, and this is what I do, or I've tried this, or what do you do? You know, it just, that human connectivity. And it creates that community within the workplace as well. And I think that really creates that stickability and that glue that makes it much harder to leave, because, gosh, am I going to get that somewhere else? You know, some organisation that has got this well-being piece working really, really well. Oh, my goodness. I mean, the sky's the limit. People aren't going to leave. Everyone's going to be clambering to kind of join them. The productivity is going to be up. I mean, happy days, right?
And reputation
Definitely.
as well. I think these things have a habit of shining through, that, you know, in terms of is reputation capital a thing? I'm not sure, but in terms of it's now. I could capitalize everything, but in terms of you know, reputation and clients and, you know, this, that and the other, I would expect that a organization that clearly has this human-centered kind of health aware, health optimizing culture, with this great community where people are happy and, you know, doing well, and you know, they've got good outcomes, they've got the really high performance. Who's not going to choose that organization over another one that doesn't have it? You know, it's going to be the desirable direction, isn't it?
Yeah. It definitely is. And again, you mentioned clients in there, and I'm not suggesting for a moment that people only do this so that they win clients. But, you know, we've seen it in the legal sector. I'm sure Kate can attest to this as well, that, you know, clients often in their pitches, when they're doing a panel for law firms, you know, they're asking about sustainability and the ESG strategy and all of that. You know, health and well-being is the next thing that they're going to be asking about. And, you know, if you want to keep your clients and win new clients, you know, you have to be ahead of the game on this, because clients only want to be working with a healthy team that's going to be there, you know, to see the project or the deal through. So, you know, it's going to be driven by client demand as well. And I think the fact that it's so front and center now in this Charlie Mayfield report, it really gives them, in a way, that this sort of stick. And I'm not just talking about law firms, you know, obviously that's my background, but it gives clients the stick to say to organizations, are you looking after your people? Because, you know, this is important. And if not, you know, we just might take our business elsewhere.
And also, as well as clients, professional indemnity insurers, I can see becoming more interested in wellbeing because of the impact it has on risk. You're more likely to make mistakes if you're not well. And also regulators, like we know the SRA's kind of started publishing some more guidelines about this sort of thing. It's like regulators, professional indemnity insurers, clients, government, everyone kind of wants you to get more proactive about the well-being. So
NHS.
Health coaching. I mean, it's fairly low cost, relatively low cost, but the way it can be sort of impact throughout the entire organization with like a ripple effect, it's just got so much potential.
And throughout sectors, you know, it's not unique to any particular setting really. It's just unique. It's just wherever there's people, because it's it's such a low risk intervention, isn't it? It's just one human talking to another human about their health in the context of their lives, and empowering that person to make their own decisions in the right way for them when they've got, this perfect, well, not perfect, but this good space, and some guidance and things to facilitate them to do it. It's just such a well-aligned intervention for so many priorities that are out there right now.
Exactly, and the numbers have got to stack up. I mean, we've talked about the business case for it, etc. But if the average cost of replacing an employee is £11,000, I mean, I think that sounds low, and I know that in law, it does feel a bit low. But I mean, it's still a chunk of money. And if 10 people leave in a year, then obviously that's significant. But I know in law, a mid-level associate, if they leave, the cost of replacing, retraining, and lost productivity is around £250,000. And I'm not suggesting you spend £250,000 on just your health coaching, but if you spent a fraction, if only, but if you spent a fraction of that, just think the impact that you could have. Even if it was £11,000, and let's say 10 employees leave in a year, so let's say it's £110,000 for the year. Imagine what that would do to a budget. And I do know that some people's wellbeing budget is significantly less than that. So if we just look at that metric alone and lift that and pop that into a wellbeing budget, I just think that would move the needle so quickly, and that's numbers that a board's going to understand.
And just another mention about cross-sector, and because obviously there are health and wellbeing coaches that are employed within the NHS, so they've got sort of more insights into the actual healthcare system, without doing clinical work themselves, obviously, but they are part of that integrated team. With health coaching, there is the potential for sort of ultimately health coaches may be working hybrid. They maybe do some work in an NHS setting, they may do some work in a community, they may do some work in an organisation, but those insights of health across these different areas would be really high value and useful, I think, for information sharing, which is another kind of what's the word, another benefit that could be gained here in terms of just integrating health across all sectors and sharing insights to move things forward quicker.
Oh gosh, we could talk and talk and talk about it, couldn't we? Have we got sort of final thoughts then to kind of pull it together? What do we think?
Oh, can I just say quickly from the clinical perspective, about the health coaching as well? It really is a good space to look at the whole person, all aspects of health, because well-being is almost synonymous with mental health, whereas we do really need to factor in physical health as well. I mean, we all think about prevention and musculoskeletal conditions and the chronic disease burden and all this and now, but I think there has been a big focus on mental health. All aspects of health are inextricably linked, because a person is a person. Mental health may present with early physical symptoms, so whole person, and that's what health coaching offers.
I'm so glad that you said that, and obviously as we are whole health wellbeing ambassadors with UKIHCA, it's such an important point to make. I think the strides that have been made out there on mental health in the workplace have been absolutely fantastic and so needed. But we've got to focus on neck down. We're 2/3 a body as well, and as you say, it's all connected. What's going on physically is going to impact you mentally. What's going on mentally is going to have impact. Is going to impact you physically and have real physical symptoms. So you're right. Someone that's presenting, again, I'm not the doctor here, but someone that's presenting with IBS, it might not just be spasms in the gut. It could be stress related or vice versa. So really important point to mention the whole health.
Also, just with that in mind as well, just very quickly, in terms of accessibility and reaching people, think about health inequalities and things. It's been November month about men's health. Let's remember that people are often more comfortable to present with a physical symptom, would say, oh, I'm struggling a bit with my IBS, rather than coming and saying, I'm really depressed or I'm really anxious and this, that and the other. So it's the health coaching is a kind of opportunity and a gateway to capture these people, these sort of health problems that may need some further intervention that can be then signposted wherever, which might not present otherwise, and until it's really far downstream and things get bad.
So it's a really good point. And you know what, sometimes if someone is presenting with something like IBS, they might not have actually made the connection that actually I'm stressed and I'm fed up. I mean, I think in some professions as well, people just sort of live in a constant kind of level of stress, and it just becomes normal, and they actually don't know that they're stressed. They're just so used to the bar being at a certain level. And I think maybe if they're sort of presenting and saying to that health coach, oh, I've got problems with my IBS at the moment, that health coach then is trained to ask those questions around, you know, how are your stress levels, what's going on, and then suddenly, gosh, the floodgates open, and you know, it's all coming out, and you know, we can then address that issue as well. So yeah, really important, valid point.
Can I just say there as well, in terms of that example with IBS, sometimes it could be the lifestyle that's going on. But you know, if you're really busy, so you're eating takeaways and you're living off caffeine and sugar, if you've got IBS, that's going to aggravate it. And is the person making a connection, or is that how they've always functioned? So unpicking some of that stuff can like make quite quick changes to that person's health. With the help support of a health coach.
Yeah, and that's exactly what a health coach does, isn't it? You know, starts looking at those habits. Oh, you're crashing at 3 o'clock and having 2 caffeines and a chocolate bar to get you through the afternoon. You know, the alarm bell's going off in the health coach's head, whereas for that person, they've been living like that for years. That's how they work. That's how they just get through it. So yeah, it's a really good point.
Another point, a final point I wanted to make was about ESG, because I think in terms of budgets and things, and where health coaching or wellbeing fits in, ESG, often people think about the climate and sustainability, which is obviously very important, but we can think about health and wellbeing of the workforce and the impact of, you know, economic inactivity in society. You know, to me, supporting wellbeing is a ESG priority, as well as just
social capital aspects as well, in terms of, you know, the human side of improving health and the impact of that beyond that workplace, you know, into the communities, families and beyond.
Yeah, it touches all 3 of the acronym, doesn't it? You know, E, S and G. It goes right across all of them. So again, you know, we're talking to businesses here. If that comes back to budget and there's an ESG budget, then you know that can support, you know, a wellbeing initiative as well.
And can I just say, human health, basically what's good for human health is generally good for planetary health as well. So isn't it? So a lot of things that, you know, lifestyle related things that a health coach might, you know, bring to a discussion has benefits in both ways. And also human health aligns with organizational health, because human health and longevity, organizational health and sustainability, and health coaching is the catalyst.
Very well put. Very well put. I like that. Yeah, but you're absolutely right. And you know, businesses are people. People are the assets, and we've got to look after them. And by looking after them, you're right, we look after the planet, and it has that whole circle of life to it, doesn't it?
Yeah, health coaching is the key.
Health coaching is the key. So if we're looking to wrap this up, I'm just conscious of time. I guess the takeaway is, look, the message is really clear, isn't it? That there's a really big shift coming, and thank goodness, you know, as health coaches have been banging the drum for long enough. And the Keep Britain Working Report, you know, has done us a great favour. But the biggest favour is going to be for the people and obviously for the businesses. The duty of care is going to be increasing. So I guess the message is, you know, for leaders, people in HR, you know, to reach out, get in front of this, you know, be the leader at the front of this, as you said earlier, you know, help shape what's coming next in terms of the report and the requirements. So I guess our message is, if you are an HR person, or you're sitting on a board, or you have responsibility for a wellbeing programme, Kate, Jenny and I would love to hear from you, or reach out to anyone at the UKIHCA. We're going to be continuing talking about this, I'm sure, for months ahead as things evolve and things change. So it'd be great if you followed us on LinkedIn. Individually, obviously, but all the messages and webinars coming up will be on the UKIHCI LinkedIn page. So definitely check that out and give it a follow. Thank you very much, ladies. Enjoy the day, and let's keep the conversation going.